pain is basically an uncomfortable feeling and sensation that is sent to the brain via the nerves. And it detects a problem in the body.
I'm 44. My joints started hurting in both my knees. When I went up the stairs, down the stairs, it was just a very sharp pain.
Well, I played sports in college. I played football and baseball for the University of Pittsburgh. And I started playing softball, and I wanted to go back and try to relive my days. So like I got all excited, I went out and I dove for a ball on a really crappy field, and I had a small tear in my rotator cuff, and I had to go to Egypt and over in the Middle East to shoot something. And literally I was there and I was in so much pain. I couldn't sleep. I was already on a different time zone. It just was probably as horrible as I can think of as far as an injury.
I'm a cartoonist and I draw comics, and I had been working several all-nighters in a row, and I had pinched a nerve in my back. And I went to the emergency room. I was in tremendous pain, and they took x-rays and they gave me painkillers, and it went on for a couple of weeks.
I'm in pain all the time, I'm depressed. You know, I'm going from a construction, very manual type job to all of a sudden I'm sitting behind a computer. So I have all this tension, I was starting to get really bad migraines.
When patients have been through several other doctors and all they're left with is narcotic pain control, it's really rewarding to find the underlying cause and to treat that. Not only treat the primary cause of their pain, but the secondary cause of their pain. Because body adds up. Your body accumulates. Once the original cause is not treated, then you have secondary causes and tertiary causes, and that's what adds up to chronic pain. Most doctors don't have time to listen, and the listening part gives a lot of clues, and that's the most important. Listening to the patient, and the examination is a critical part. Radiographs such as x-rays, MRIs are important in certain cases, but I usually find out the primary cause on my first evaluation.
Pain's almost completely gone. In fact, when I go to the gym now, I used to avoid the Stairmaster and anything that would be a little bit harder on my joints. Now I run on the treadmill and I actually get on the stair mill.
I really had no belief that it would work. And so I did the manipulation, and I lied to you not. I went from 40% to about 80% in one session. And over the course of 6 months, I got all of my strength back and all of my mobility. And so the chiropractor was telling me I was probably gonna have to have surgery, and I didn't want to have surgery, and I didn't have surgery, and now I am pretty much 100%. Actually 100%.
It still hurt until I got home, and then the next day, totally fine. All the pain was gone. Like it was relaxed. It still ached a little bit. I could still feel the tingling in my fingers, but other than that, I was done. It was amazing. It was amazing.
I mean, can you imagine going like 3 years with migraines and your back is stiff and your arms hurting? And I would come in here with migraines, and literally the first time I did it, I walked out of here without a migraine. And I had been with migraines, you know, suffering with them for days and days and days.